My name is Mindy Salango, and I live in Monongalia County, West Virginia. So I was employed full time. I had health insurance through my company. However, due to my divorce and our insurance not being that great and the coverage not covering everything that I needed, my out of pocket expenses for my diabetes, including my insulin and supplies, was as much as my mortgage. So for a year, I had to ration my medication. For a diabetic, that is deadly and can lead to long-term complications. Because of that year, I now have diabetic retinopathy. I couldn't make ends meet. Um, and like I said, my insulin cost as much as my mortgage every month. And, I wasn't making great money. I was able to survive, but the last couple weeks of every month were tough, were very tough. And I would have to eat a lot less so that I didn't require as much insulin. Um, and when I say eat a lot less, I mean, I wasn't eating much at all at that time during those couple weeks and each month. And, not taking as much insulin as was required and that my body required to sustain. So my blood sugars would easily be over 300 pretty consistently, over those couple weeks so that I could stretch my insulin out until my next payday. And I've always felt like I was kind of like behind the eight ball. You would get the mortgage paid or you'd hold off on the electric bill until next month, so that you could get your insulin. I was always behind the eight ball on something so that I could try to stay alive. And, I'm fortunate that I was able to find another job so that I didn't have to do that any longer. But it was a real juggling act. It was very stressful. Stress will cause your blood sugar to increase. People don't realize it's not just food that makes your blood sugar increase. It's stress, it's hormones, it's, all of those things. And it was a very scary, dark, uncertain time. If I lose my job tomorrow and don't have health insurance, my insulin would cost $1,200 a month, and that's insulin alone. It is, without insurance, insulin is $300 a vial, and a typical type 1 diabetic uses between 3 and 4 vials a month. And that has gone up around between 1,200 and 1,500% over the last 15 years. There's been no change to the formulation. There's been no reason for that cost increase other than greed from the drug companies. When I was first diagnosed 28 years ago, insulin cost about $20 a vial without insurance. Now it's over 300. People are struggling to survive. And then when they have diabetes on top of it, it's almost a no-win game. People have died from rationing. People have died going without insulin because of cost. 1 in 4 diabetics in the type 1 diabetics in the United States currently ration insulin due to cost. I would say in Appalachia, that rate is much higher. And it's sickening to me. It really is that there's so much emphasis on profit over patients. The original patent for insulin was sold for $1 because the people, the gentleman who discovered it and refined it said, this doesn't belong to me. It belongs to the people who need it. But now it doesn't belong to us at all. Like I said, we're at the will of a drug company representative who wants a big bonus. It's just, this isn't the way that we should live. Our The job of our government is to take care of its people, specifically its most vulnerable. And we've really been left behind. The healthcare system in general in the United States is abysmal, but for diabetics, we're left. I feel like we've been left behind, and with a deadly disease that we fight every day to stay alive. And I don't I don't know what we need to do to get through to get something done. I don't know what else we can do. How many casualties of insulin rationing does it take for someone to say, finally, enough's enough? We've lost too many people to this. And people are, coming up with horrible, horrible, lifelong ramifications of rationing their insulin. And when it can be completely avoided, we just have to rein in greed. And until that becomes a priority, we're going to suffer.